Do we need to do more to help problem drug users? The number 08085 92 95 00.
Your calls, your stories.
Mornings with Kaye Adams on BBC Radio Scotland.
So yesterday we got the news that Scotland had the highest number of drug deaths per head in the EU. 867 in 2016, which was an increase of 23% on the previous year. Today, a BBC Scotland investigation reveals that only 42% of problem drug users in Scotland are in treatment, with some waiting up to 6 months to get it. The Scottish Government says that 93% of problem drug users are seen within 3 weeks. That's the target. And an extra £20 million is being spent annually. Now, we're going to ask Austin Smith, the policy officer of the Scottish Drugs Forum, to give us a little bit of clarity on that. But since 2008, the Scottish Government say more than £750 million has been spent on tackling drug and alcohol misuse. So the question is, do we need to do more? Not necessarily about money, perhaps about money, but do we need to do more to address this situation? What more can we do? What more should we do? Give us a call. 08085 92 95 00 is the number. If you or a loved one has struggled with drug addiction, what support did you get? Was it what you needed? You can text us on 80295 or email kaye@bbc.co.uk and ponder on this. What is it about Scotland and drug misuse? Why do we have such high rates of addiction and death? Do get in touch. 08085 92 95 00. Paul in Renfrew says the government need to consider decriminalisation. Prohibition's not working. Just criminalises addicts and makes the bad people very rich. Time for harm reduction. Another couple of texts in. It would seem Scotland has the highest in everything. Most of drug abuse is self-inflicted. There are more deserving cases. And someone else saying, what about more help for the children of drug users? Tell us what you think. Do we need to do more to try and improve the situation? Austin Smith is from the Scottish Drugs Forum. Good morning to you, Austin.
Good morning, Kaye.
Good morning. I'm slightly confused by the picture here. I mean, so we've got these figures telling us that we have the highest number of drug deaths per head in the EU. So we have a problem. The government is saying, Scottish Government is saying that 93% of problem drug users are seen within 3 weeks. That's the target. And yet this other figure is saying that only 42% of problem drug users are in treatment and some are waiting up to 6 months to get it. So what is happening here?
Okay, well, this is explicable, but it is complex. I'll try my best. The figures you need to know are that in Scotland there is an estimated population of 61,500 people with a drug problem. So those are people who have a problem specifically with either an opiate like heroin or a benzodiazepine as kind of Valium type drug. And what the government are saying to you is that of the people who present for treatment, 93% are seen within what's called a heat target of 3 weeks. So that's a government set target which health boards have to report on. So 93% of people are seen and get into treatment, as they say. The problem is that they don't define treatment. So you and I may think of treatment generally for people with a heroin problem would be getting onto methadone, getting your methadone prescription and support. So the truth is that people seem to be waiting, as you say, up to 6 months for that support and for that prescription, and in the meantime are getting something else which isn't defined, but may be group work, or they may be seeing a worker once every fortnight and filling in a diary of the drugs they use or some exercise like that.
Right.
And then what the government are saying to you is that 42% of all that 61.5% are actually in treatment. So 93% of people presenting are getting the treatment within the time, but it's only 42% of people who present, which raises the question about, well, why don't more people present for treatment, and why don't people present for treatment earlier rather than when they're in an absolute crisis?
Is it working?
Well, the issue, Kaye, is always what we mean by working. Okay, so
is it effective?
Yeah, effective. The effectiveness of methadone treatment for heroin users is well established through an international evidence base, and what it's effective in is giving people some stability in their life. So if people are prescribed an adequate amount of methadone to stop them using street drugs and take them away from that lifestyle involving for most people, some kind of criminality in gaining the money to buy the drugs and spending their whole day in that process, if the stability gained from taking all that away should be a platform for people to address other issues they might have in their life.
Right.
So those are maybe issues that stem from their childhood, from trauma people have had in childhood. So we've got a huge overrepresentation of people who've had difficult childhoods, who've maybe been in care of the state and been brought up in care and then left care, and overrepresentation of people who've been in young offenders institutions. There are people who've been in trouble in their early days. Amongst that group. So it's about dealing with those issues and they are carried from then, and also from traumas that people experience in terms of their own problem drug use and that of others, witnessing overdose and witnessing the death of friends and so on.
I am aware, of course, that it's a very complex picture, Austin, and I'm also aware that I'm asking very, very simple questions and there is a bit of a disconnect there. But for people who are not familiar with the pattern of drug use and indeed the treatment programs that are available, you see the headlines and you think, well, why is that? Why has Scotland got so many drug deaths? I mean, why should we be at the top of this particular table? What is it about us?
Well, there are. What is it about? It would be a big question, but I suppose that there's key factors in it. One of the factors is what happened to Scotland after the war and in the economy, particularly in the 80s and 90s, and the disintegration of industrial Scotland, and the unemployment that came with that. And we also have in our cities housing schemes which were built for a purpose to house people in the local industry and so on. Where that industry goes, that whole community can suffer greatly. And also we have a very poor record, frankly, in terms of looking after people who are in trouble, particularly children and young people, and engaging them with the rest of the community. So what doesn't help is alienating people. And what seems to have happened, particularly with injecting drug users, heroin users, is that people in Scotland will tell you that they're very inclusive, that we're all Jock Tanson's bairns, except for those people. And by those people, they mean people who inject drugs. People just find it a completely alien behaviour and inexplicable and shun people like that. And I'm afraid what we have to do is to look at ourselves and our attitudes and to engage better with that population.
So in terms of one of our other very simple and broad questions, and I'm absolutely putting my hands up to this, Austin, should we do more? Is that a difficult question for your community to ask of the general population? Are you saying that you generally don't get a particularly welcoming reception to that?
No, well, what's happened is that services working with people with drug problems have become marginalised. So actually, people who should be working with to support people around their drug use and about their addiction should be normal mainstream services. So there should be housing services, education services, training services, services that support families and young people. And that it's around those kind of areas that people make progress in their life. So we shouldn't like drug addicts themselves, people with addictions. We shouldn't become fixated about the drug use. We should be interested in the wider person, if you like, and take a kind of whole person approach and say, what's needed to help this person to make progress in their life.
Okay, so instead of kind of ghettoising drug misuse and ghettoising the services that would be seem to be appropriate in order to try and tackle it, we have to kind of embrace it more. And I don't use that in a facetious sense at all.
And particularly even within the NHS, so the government will tell you that a lot of money's been spent on this group, and that's absolutely true. And there's been successes with that. There are people making huge strides in their life, but this group of people will be underrepresented in terms of engagement with other services. Mm-hmm. They'll engage with accident emergency and with the drug service, but they may not even have a GP. Mm-hmm. They may not have support with their mental and physical health that you and I would expect if we had problems.
Yeah, it's interesting actually, because we spoke to a young woman yesterday on the programme. As it happens, it was purely coincidental, who had been a drug user, well, a heroin addict, and it was only when she became pregnant and was then connected into maternity or antenatal services that she got the support that helped her to turn her life around, and it is a very good news story. You know, her baby's 5.5 months old. She's a wonderful and proud mother who has left drugs behind, but it took that to get her connected into mainstream services, whereas previously, for the years before, she had kind of been adrift. Whether she had been cut adrift or she just was adrift, you know, who knows? But it absolutely exemplifies what you are talking about there, Austin. So thank you, Austin. You did a really good job of explaining a very complex situation there. So that broad question of do we need to do more is really relevant. It could be about money, but it's not just about money. As Austin explains, perhaps it's about taking a different attitude towards people who are addicted to drugs, seeing them as part of mainstream society and offering services as part of mainstream services. But we'll take that broad question. Do we need to do more? 08085 92 95 00 is the number to call. Stephen in Glasgow, what do you think?
Certainly not, Kaye. We shouldn't be doing anything for these people. And for that last gentleman there to say they blame society for the way they were upbringing, I had a terrible, terrible upbringing. I was in care homes. I wouldn't say I was really abused, but I was mentally disturbed many years ago when I lived in an island. And not one of my friends turned to drugs or drink. But that's what they're saying now is, oh, these folk were abused. They're always blaming their past. How many professional folk in society has lost children through there? It's a great upbringing. Totally not. All we've done is turned this city of Glasgow and other places into the city of zombies. They're high up in the benefit system. They've got every benefit that's going. They go to these chemist shops. They get priority. All they're doing is going out there. I would say 80% of them, they're mugging folk in buses. They're mugging folk in streets. They're murdering people. I would say they're doing far, far too much. And £700 million is a disgrace. It's a big, big business now. That's what's wrong. We're the normal ones.
Okay, well, let me ask Austin to respond to you there, Stephen, because I don't think your view will be entirely unusual.
I would do nothing for him.
So, Austin?
Well, you know, the attitudes expressed there are representative of some people's attitudes, and I force myself to.
That's Scotland's attitude.
Oh, okay, Stephen. Let Austin respond, Stephen.
I force myself to try and understand that, but from a practical point of view, that attitudes like that will not help this situation. So the question is, what do we do? And I think you're right.
That's what I would do with them.
Well, that may be so, but if we actually want to...
Put the whole lot of them, the ladies, put them, there's 61,000, go and get a wee Scottish island, put the whole lot of them in there, and that £700 million you've got, and see if you can cure some of them. If you can pull some of them out of there into society and rehabilitate them, fine, but feeding them every day, feeding that habit, getting them throwing hundreds of millions of pounds, all you do is keep fat cats in these jobs. Pharmaceutical companies are making millions. Doctors, for everyone they prescribe this heroin stuff and these substitutes, they're getting hundreds of thousands. And the poor folk is on these streets. They don't even feel safe. They feel intimidated.
Okay,
they walk in these streets. They're murdering folk.
Okay, Stephen. Okay. Clearly, very, very strong views here. We hear from Stephen. Very unsympathetic to the situation of people who are addicted to drugs. Tell us what your feelings are. 08085 92 95 00. Austin Smith from the Scottish Drugs Forum is saying that we have to have a much more inclusive approach to people who fall victim to drug addiction. Would you use that expression? I don't think Stephen would. He would very much see it as something that is self-inflicted, and I think he used these words. And I suppose if we are coming down to do we need to do more, or perhaps do we need to do differently, our attitude towards people with drug addiction is key to that, because that is going to steer what we are likely to approve, what we're likely to sanction and embrace. So what would you do? Do you think we need to do more in a positive sense? Would you spend more money if it was about more money? Or is it a case of doing things differently? And your experiences, if you or a family member has had a drug addiction problem, what would you do differently? What kind of support was there for you? We'll speak to Peter in a second, who is a recovered addict, and we've got Stella in Dundee who wants to speak to us, but join in the conversation, 08085 92 95 00.
The experts say it can mean the difference between life and death, but drug addicts in Scotland are having to wait up to 6 months for help to deal with their problems. Figures uncovered by the BBC suggest around 40% of problem users are eventually managing to access treatment, but that compares poorly with the situation south of the border. Earlier on the programme, we heard from Colin McNair, a former professional footballer. He played with Hearts, Falkirk and Motherwell before drugs sent him on a downward spiral.
The drugs had stopped working. It only took away the physical withdrawal. And basically I wanted to die at the end of my using, but I didn't have the courage to end my life. I would say the lowest point when I knew I needed help was when I was sitting begging in the street, or when my mental health got shot to pieces. I thought I would get in because I'd never been in treatment before, and it took 6.5 months, but they say it's a process we need to go through. There's thousands of people wanting the kind of help that you're wanting. As I say, so it's just a matter of when your number comes up, we'll give you a call.
Well, Austin Smith is a policy officer with the Scottish Drugs Forum. Good morning to you.
Good morning.
And is it the fact that there are thousands of people waiting, as Colin McNair suggests there, that is at the root of these figures?
Yeah, there are a lot of people waiting. We don't know the numbers, but there are a lot of people waiting for treatment. And it's important to bear in mind that when people present for treatment, it's not with early symptoms. People are presenting in absolute crisis. As your guest said, in a state of wanting to die, and a huge social crisis as well with their health and their well-being.
So would you share that assessment that accessing this treatment can be the difference between life and death for some?
Of course, people present in crisis, and very quickly they can be stabilised, particularly people in heroin with medication that can substitute for that heroin, and can act as a basis for treatment. In the sense that it brings stability to people's lives, no longer using street drugs and get away from that home scene. But that has to be done properly. That has to be an effective treatment.
There seems to be an issue in different parts of Scotland as well, because service providers are telling the BBC in some areas it's possible to get a methadone prescription within weeks. In other areas it can take up to 6 months.
Yeah, I mean, that's true. That's what we hear as well. Some of that will be to do with how they've chosen to interpret your question, whether that would be for everybody who could benefit would get on methadone and quicker or whatever. But people are certainly waiting 6 months, and particularly in large cities. In Edinburgh, for instance, I'm told that people can have substantial waits to go on methadone. And in the meantime, they're engaged with services in a very kind of loose way, maybe keeping a diary of drugs that they're using and so on. But it's not the treatment that they presented for in crisis.
So explain to us the root of this delay then, if you're in Edinburgh and you present looking for help.
Well, as you can imagine, it's complex. But part of the problem is simply the capacity of services. We've had cuts in service delivery and a refocusing of services around moving people towards abstinence. And so there's been less of a priority on people who are some way from abstinence and are really struggling with their drug use. So there's been a kind of disinvestment. So even when the overall funding may be the same, services are now providing a range of things, including abstinence programmes and so on.
And does there need to be that treatment element in the middle to move from being a drug user to abstinence?
Yeah, I mean, yes, for many people, I don't want to give absolute space. For most people, treatment will involve, and medication will involve part of their journey from using street heroin to abstinence, if that's the journey that they make.
How much of this is about money?
A lot of it's about money. Of course, as with all parts of the NHS, there is a squeeze on budgets and so on. But part of it is also to do with the configuration of services. Services are large. Individual frontline staff have large caseloads and are working with people, partly because of the way the methadone programme is implemented, are working with people, they're seeing people very regularly, and those people are getting no other supports from other services. So all of the help they are getting, they're getting directly from a specialist drugs worker.
And just finally, when it comes to that decision on who gets the methadone treatment, what ultimately is that decision based on? Is it financial or other considerations?
Well, there are other considerations about people being treatment being suitable for people. But the thing I would say is there's been a kind of focus on methadone, but actually we should have a whole range of things, including more long-acting substances potentially, that people wouldn't have to go to their chemist every day and so on, so they'd be less intensely involved with services and could do other things in their life.
Okay, thanks very much for coming in to speak to us this morning. Austin Smith there from the Scottish Drugs Forum. It's 19 minutes past 8.
Now.